Bismillahirrahmanirrahim. Assalamu alaikum everyone. A very warm welcome to all of you in this Operative Dentistry Symposium. And today we'll talk about, especially I have chosen the topic about guiding you regarding Rotary Endodontics. Okay, you all know to run a dental practice successfully, you need to master your skills in endodontics. So that is why I've chosen this topic, and especially now the standard of doing endo is by Rotary method. So if you know how to do it successfully, you can deal the patients in the best possible way and ultimately have a good practice. To be successful in endo, you need to understand the basic objective why we are doing root canal treatment. The main reason is that the root canal space has become infected, diseased, or has got bacteria inside it. So the main objective is to remove all the diseased tissue and all the pulpal tissue, all remnants which are there. So for this purpose, we use two things. One is our mechanical instrumentation, which is the instruments that we use, the files that we use. They can be the manual ones or the rotary ones. So the first thing is that, and the other thing is our irrigation. Because we cannot completely remove all the diseased tissue just by our instruments or our files, because the canals, they have so many spaces which are intercommunications, lateral canals where the files cannot reach. So on those areas, we are especially relying on our irrigants. So that is why to eliminate irritants, we need to have good irrigation along with our mechanical instrumentation. And ultimately, once you have cleaned the canal, you need to seal it in the perfect way so that the bacteria cannot re-enter the canal. So first thing is your cleaning and shaping, and the second is your obturation or your sealing of the canal. Both things combined will result in a successful result of root canal treatment. Clinically, if we talk about, we need to preserve and stabilize the tooth function, and that is why we are doing root canal treatment, so that we can save the tooth. Otherwise, in most such cases, the other alternative would be extraction. Like when we're dealing with patients who come with pain and have got these big cavities, they always ask what's the treatment for it. So we tell them that root canal treatment is the best option for it. They ask what could be the alternatives. So I tell them that the other alternative is only extraction. So in such case, you definitely will have to go for root canal treatment, and that is how we are saving the tooth and rebuilding aesthetics, function, and everything is restored back. There are certain considerations while we are doing root canal treatment. Well, I'll just talk about them briefly, and then we will come to the main topic of rotary endodontics. So each one has its importance in the success of root canal treatment. Okay, this is a sequel, how we follow a case. Initially, we start by diagnosing the case. We diagnosis is, you know, the primary thing. So we diagnose it properly. Then we need to make our plan how we are going to restore it. Because it's not just that we do root canal treatment, the plan of how to restore it is equally important. Whether we just need to do a filling in it, whether like here you can see that in some cases you require post placement. So you need to do a post and core along with ultimately a crown of the tooth. In some cases you can just have a filling and a crown. You can in the end you can give a crown also. So that is why this famous saying, if you fail to plan, you're planning to fail. So your plan has to be made right in the beginning, how you're going to preserve that tooth and see the importance of the tooth in the arch and decide how you're going to manage the case accordingly. Okay. Access, it's mostly said access leads to success. So if you have a good access opening, you can visualize all the canals, you can locate all the canals easily. And once you have located the canal, then comes your step of your cleaning and shaping. So access is very important. Like here you can see in a study which quoted that if your access is not done properly, maybe you can miss up to 42% of canals in cases, which can be a major cause of root canal failure. So access is important. And if you talk about principles of access, the first thing is you need to remove all caries. And while doing this, you need to be as conservative. So access, you have to see it in two ways. You do not have to be too destructive, but the caries has to be completely cleaned or eliminated. But at the same time, you need to try to preserve as much tooth structure as possible, because ultimately the success or the prognosis of the tooth depends on how much tooth structure you have preserved. So that is why access is of prime importance in your root canal treatment. Okay, here also you can see in a case, if your access is proper, in an upper molar, you will see that there are a high percentage of cases where you can find an MB2 canal. So if your access is proper, you will have high chances of locating an MB2 canal. Okay. Then after access comes the step of negotiating canal and shaping the canal. So like I told you in the beginning, it's very important to remove all the diseased tissue, and that we are doing this by doing proper instrumentation. So if your shape is proper, if your instrumentation is proper, you are not just eliminating all the major parts of the microbes or the microorganisms, you're also facilitating good irrigation into all parts of the canal. So that is why you can see if your shape is proper, then you can have your irrigants reaching all the deeper parts of the canal also. And then you will have a proper filling. Because your obturation reflects the shape of the canal. Your obturation can only be good if you have done good shaping of the canal. And here you can see that despite doing instrumentation, there can be certain areas in the canal which your instruments may not be able to clean. So these areas, like the green areas, they will be housing the bacteria. So here we are relying on our irrigants. So that is why we use the term cleaning and shaping. The cleaning is done by irrigation and shaping is done by our instrumentation. Okay? And another important aspect, root canal treatment, usually we are doing in visits. So during or in between your visits, your seal should be adequate, or there should be ideally an intracanal medicament in the canal, because if you're leaving the canal empty, then there are again chances that the bacteria can re-enter the canal. And ultimately your obturation. See, a well-shaped and clean canal must be filled as completely as possible. Like I told you, the seal is important, otherwise bacteria can re-enter the canals. And finally, the coronal restoration. A number of studies have quoted that the main reason for root canal failure is lack of good coronal seal. So if your coronal seal is not good, then bacteria will re-enter and will cause reinfection. That is why if sometimes the patients present, they've got the root canal treatment done, but they have a temporary filling. So we always confirm that how long has the temporary filling has been there. If it's been there for like more than a few months, then we always tell them, despite having no periapical lesion, we would tell them that you should get a root canal treatment done and then have a coronal filling and a crown on top of it. Because in this period, bacteria would certainly have re-entered the canal and would later on cause reinfection. So why we should opt for rotary endodontics? Okay, we have been doing manual endodontics since quite some time, and the success has been there. The main reason is now the change in the instruments or the materials of the files. Previously, manual instruments were mainly being done with stainless steel instruments. With rotary, now we have NiTi files, nickel titanium files, and even in those, with time, there's been advancements, like the gold alloys, due to the change in the metallurgy. So they make those files very flexible. So in areas where previously the manual files would have been difficult to reach those areas, now with nickel titanium files, it's more easy to reach those areas of the canals also, and to shape them properly. The other main reason, which I think for a good clinician, time is the most important thing. Like whenever a patient is asking us the cost of treatment, we tell them that the cost is based on our time. It's not based upon the cost of the material that we are using. It is the time that we are giving you, that is the value of the root canal treatment. So time, with rotary, you can do a case in single visit. With manual, you may be able to do it, but to do a proper case of a molar, you may take quite a long time. And with rotary, the time can be reduced significantly. The shaping, like I told you, with the difference in metallurgy, the shape that you achieve with rotary would be far more superior than what you could achieve with your manual instrumentation. And because of the change in metallurgy, you will have less procedural errors also. Because with your stainless steel files, manual techniques, you have more chances of apical transportation, ledge formation, zipping. So these all can be reduced if you're doing rotary endodontic. So here you can see if there is an initial shape of the canal. With rotary, or objective should be the shape of the canal should be maintained. And you can see with manual, you would see that there are high chances that this apical curvature may not be negotiated that well, and ultimately you will result in apical transportation. That leads to some part, the apical part of the canal, either being uncleaned or unfilled, and that can later on cause problems. So with rotary, it's easier to follow the shape of the canal, which is our objective, that when we're doing rotary, the initial shape of the canal should always be followed. Now coming on to the main topic about rotary endodontics, what things can we do to have a good result or to have a safe and effective root canal treatment? There are certain rules which we can follow. You know, one of the principles of access opening is straight line access. Why should we opt for straight line access? You can see that in the corneal part of the canal, there's a slight constriction. So that hinders the file going easily to the middle or the apical parts of the canal. So if that constriction is or we have dealt with that constriction in the beginning, then you have a more straight line access, so then you can go more easily into the middle third and the apical third. That is why straight line access is emphasized. It will help you negotiate the canal better. Like here you can see before straight line access and after straight. Now you can see once the corneal constriction is removed, the corneal part is flared. Now your files can go more easily into the deeper parts of the canal. Okay. Then comes negotiating a canal. We all know when you're negotiating canal, we use this patency file or 10 number K file, which is used to negotiate canals. So with this, with our watch winding action, we slowly try to negotiate the canal, and this way we need to reach the working length of the canal. And then we can move on to our rotary instruments. Your working length needs to be accurately determined. For that, you can have a radiograph as well as your apex locator. Because one other objective of root canal treatment is that your apical stop should be at the correct position. If your files have gone beyond the apex, that means you have created an open apex, and now the bacteria or everything which is inside the canal will go into the periapical area and will result in periapical inflammation and could ultimately jeopardize the long-term result of root canal treatment. Glide path is a term which means that before your actual rotary path, you need to create a path for the rotary files which it can easily follow without any hindrance. So this means that once you've used your patency file, then after that you need to flare the canal or just have a shape in which your rotary files can go more easily. Like here you can see there are different options of rotary files. Either you can use your hand files, or now you have even rotary files available as path files or pro glider, which help you create a path before use of your final rotary instruments. And like I told you, irrigation is of great importance, and to get a better result in irrigation, not just the type of irrigant, it is the type of needle or the size of the needle that you choose is also important. So for good irrigation, one, your good irrigant, which usually as a standard we use sodium hypochlorite, and your needle size is also important, because if you see that if the canal size is enlarged up to a 25 number file, then even just a 30 gauge needle will reach the apical area. So if you're using a wider needle, like commonly a 5 cc syringe or a 3 cc syringe needle we use, that will just remain in the coronal part of the canal. With that syringe, the irrigant will not be able to penetrate into deeper parts of the canal. So for that, we need a smaller gauge needle which can go into the deeper parts of the canal. So that is why your needle size is also important. And then while we are doing rotary endo, one other thing that we need to be careful of is while doing manual, sometimes we do apply pressure. Our files may not be going that easily to the apical area, so sometimes we do apply pressure. But in rotary, it has to be very controlled. Like here, it's shown that if you're using, it's using a sharp pencil. If you're using a sharp pencil, you write it down with it very gently. The moment you apply greater force, the nib of the pencil will break. So here also, you need to be careful while using rotary because it's already running in an electric motor, so you do not need to apply that much force. You just have to move it gently into the canal and it will do its work. So minimal pressure, otherwise, like here it's shown the sharp pencil nib can break, so similarly a rotary file can break. Then your instrumentation time. With rotary file, you just have to take the file into the canal. The moment it reaches the apical area, you can take it out of the canal. So like here it's mentioned as a 10-second rule. So your file can be in the canal for 10 seconds, and then you can just take it out. You do not need to keep it there. Otherwise, these rotary files have a property of cyclic fatigue. After a certain number of rotations, they will break or fracture. So before that, so that's why you need to limit your instrumentation time. You just need to take it into the canal for a few seconds, and then you take it out of the canal. It will do its work. With rotary files, the major problem is of file separation. So for that, you need to be careful. The ideal guideline is that you just use your instruments only once. In every case, you can use new instruments, but here it may not be that feasible. So you can reuse your instruments, but you should always re-inspect the files. If there are signs of distortion, wear, any sharp areas, any bent areas, the file should be discarded. And if you're working in a molar, like if you have worked in one canal, before going to the next canal, you can clean your files. The flute should be clean so that it can work easily into the next canal. So I'll just talk a little bit about one of the systems which is available, which is the Pro Taper system. Because in rotary, you have different systems available. But just as a guide, the most commonly system used here is the Pro Taper system. So I'll just give you an initial guide how to go ahead with this system so that you can get a good result. So this system, you know, maybe most of you might know about it. It comprises of 6 files, 3 shaping files and 3 finishing files. The first shaping file is a short file. The main purpose of it is for use as a coronal flaring file. So you enlarge the coronal part with this. This does not need to go all the way to the apex. Then you have the shaping files. This you can see they're wider in the middle part or the coronal part, but they're very narrow in the apical part because their purpose is to enlarge the coronal 2/3. And for the apical 1/3, then you have the finishing files. So the yellow one, F1, red one, F2, and then the blue one, which is F3. So you can see here, their taper in the apical area is far more than the shaping files. The shaping files were only 2% and 4%. Here, the finishing files are 7, 8, and 9% because they are just engaging in the apical part. So once you have used the F1 file, then you can see whether you can just finish the canal at F1 or you need to move at F2 or F3. So these files will just do the apical finishing of that canal. Now just to summarize, there are certain guidelines. Like I told you, you need to work with light resistance. You do not need to force the files. You always work in well irrigated and lubricated canals. And you take the file into the canal. Once it goes to the apical area, then you can just take it out of the canal. You do not need to leave it there for a longer period, otherwise the file can fracture. You will get the guidelines about the speed by each manufacturer. Like for the Pro Taper system, it's usually recommended that you can have the speed range between 250 to 350 RPM. And you need to clean the fruits of the file and inspect them frequently. As soon as you see any signs of distortion or wear, you need to discard the file. So just a few steps of how to go ahead with the Pro Taper system. Once you have done your access opening, you have negotiated the canal with your patency file, you can enlarge the coronal part with either your S1 file or you can do the coronal flaring with your S6 file. Once you have enlarged the coronal part, you can confirm your working length with your patency file, the 10 number K file. Once your working length is confirmed, then your first shaping file goes to the full working length. Followed by the second shaping file, S2, which again goes, this will go more easily because the first one has already enlarged the canal to a greater degree. So now the shaping file, the second shaping file will just have to do little work. And then comes your finishing file. Then you use your F1 or your first finishing file. Once you have used this, then you need to decide whether you need to move on to the second finishing file, which is F2 or F3, or you can just finish the case at F1. The way to go about it is that you need to judge the initial diameter of the canal. If the canal is narrow, like the mesial canals of lower molar, mesiobuccal of upper molar, then you can just finish the file with your F1. And you can also judge it by using your 20 number file, because the tip of the 20 number file corresponds with the tip of the F1 file. So if the 20 number file is tight in the apical area, then you can just finish it at F1. If it's loose, then you need to move on to F2. And after F2, you can check with a 25 number file and see if it's tight, then you just finish it at F2. If it's loose, then you can finish it at F3. So this is just how you need to go about with especially this pro taper system. Similarly, you just need to file this, to follow the sequence of any files if you're using any other system also. But like I told you with Rotary, the most common problem is of file separation. And the main reason for it is overusage of files. Because हम में से किसी का भी दिल नहीं करेगा कि एक फाइल को डिस्कार्ड कर दे जब तक वो और यूज़ हो सके. हम लोग की कोशिश होती है बिल्कुल वो लिमिट तक चल जाए. तो अब उससे पहले आदमी को अपना दिल बड़ा करना होता है और उसको फाइल को अलग, क्योंकि अल्टीमेटली लाइक आई टोल्ड यू उसका रिजल्ट यही है, द फाइल विल सेपरेट. उसमें होता है द प्रॉपर्टी ऑफ साइक्लिक फटीग इज देयर, आफ्टर सर्टन नंबर ऑफ रोटेशंस इट हैज़ टू ब्रेक. तो उससे पहले आपको उस फाइल को डिस्कार्ड कर देना होता है, वरना फिर वो पेशेंट ही आपके लिए फिर प्रॉब्लम हो जाएगा. सो यू नीड टू फॉलो दिस. आइडियली लाइक आई टोल्ड यू ओनली वंस इज द सेफेस्ट नंबर, बट हियर इन आवर सिस्टम we might have to use it more than once, but you need to be careful or keep a track. Keep a track like how many cases you're doing. If you're doing a difficult case, mark it. Don't use it in another difficult molar. Use it in an easier case. So this way, in a combination of like anterior and a couple of molars, you can make your file last maybe like for 3 to 5 cases or so. But it should not be more than that. Otherwise, like I told you, there are chances of separation. And even doing this, you need to inspect your files frequently. As soon as you see any signs of distortion where you need to discard it. Thank you, and I hope you were able to assess or understand the guidelines regarding Rotary endodontics. Before ending, I'll just show you a couple of cases to see how with Rotary you can get good results easily. So here also you can see in the premolar, don't look at the implants, but the premolar here, following the curvatures become easy with Rotary endodontics. In every case, you will see the curvatures and the shape that can be followed in a better way with Rotary endodontics. Okay? Thank you very much.